infection. So we want to take every precaution necessary to prevent infection. One of the precautions is that we put a mask on our patient. Right? Put a mask on our patient, and we put a mask on ourselves. Of course, because of our kids, they have our mask in here. But usually when you go into the patient's room, you have masks by the door, right? That's not a problem. So you would just go ahead and proceed and put the mask on if you know you're doing a central line dressing change. I'll wait because my mask is in here and I don't know where all the other masks are, so I'm just going to do that. So this is your sterile kit. Bio patches. Some of the kits have bio patches already within the tegaderm of the dressing. Some do not. You just need to make sure you read your ingredients, like a recipe. Read your items that are listed in your kit. I know my kit does not have a bio patch, so I got one. If you need a larger than medium gloves, make sure you bring gloves as well. The kit has sterile gloves in there. I was gonna do a dressing if there didn't have a dressing, but I don't need that. And I like to have a sterile gauze, an extra sterile gauze, just to hold my catheter up, okay? A lot of times in the hospital, I'm not gonna do it here, but when we're changing the dressing, we also change the hubs. Okay, just look at your policy and protocol within the hospitals to see what they require and how often. Usually dressing changes are done as needed. If there is wetness to the dressing, we want to, put a new dressing on. If there's some blood there and we want to inspect the site, or if it's within 7 days. Usually, PICC lines are also considered central line dressing changes. A PICC line, within the first 3 days, we may have to change it. It just depends, again, on your protocols and what you want to do for the first dressing for the PICC lines. Thereafter will be every 7 days or as needed, again, okay? So I'm going to use this dressing change, so hopefully everything is set. So now I'm going to open up my kit. I tell my patient what I'm doing. I'm going to change your dressing. So I would like for you to just put your face, face that corner of the room, the left side. So you are not breathing here, but I'm also going to put this mask on you. Sometimes patients don't want to wear masks, and if they're following directions, as long as they keep their face away from breathing around that site, that's fine. So hand hygiene before I come into the room, and I'm going to go ahead and open my kit. Now I do have a field. So this is my sterile field. I'm going to open the outside. One-inch borders. Here's my mask. Now, your kids are not going to have a mask in there, like I said, but for our purposes, we do have a mask in there. So you can, after you're practicing, you can just keep it out and put it in as you proceed. Put your mask on. Get your gloves. Now, normally I would have the patient's table where I'm working on. Maybe I'll get another table. Hold on. So this is the patient's bed, and this is their overhead table. And because if your BioPatch is not already in the kit, you want to drop it into a sterile field. So how you do it before you put your gloves on, right? You want to drop the BioPatch in there. And I like to use an extra 4x4. Well, there is a dressing in there. Oh well, I'll just drop that in there just in case I need it. Okay. Now I put my gloves on. Make sure that you're putting your gloves on sterilely. Now, before I do that, I'm going to go ahead and start loosening up my dressing. Now, I don't know how long this has been on, but it's probably hard to take out. But I do not attempt this unless I have my mask on, right? It's not usually this bad because the skin, has oils. So, but this is a fake mannequin, so this is going to be hard to take out. Okay. Again. So what I do is I remove it. Oh my goodness, it's very sticky. You can also use alcohol to try to get to the edges of your dressing. Make sure you secure your catheter.
When we test for this, we're going to be using this guy?
You're going to be using the mannequins.
Okay.
Hopefully they have dressing on there. If they don't, then you'll go through the steps.
So you're pulling the dressing off completely without sterile gloves?
Yeah, I'm not touching that area. I'm just touching the old dressing.
Okay.
I'm making sure, remember I did hand hygiene. This area does not get touched. Now, the person that of course the mask wouldn't fall off the patient. The person that put this in, put it in correctly. The bifurcated area of the BioPatch is down, so when I pull it, it pulls out easily, okay? Okay, so, but I do not attempt to do this until I have my mask. And I've never touched the area of insertion without gloves. Okay? So now I proceed. I do hand hygiene.
Would you probably have just normal gloves on while you're doing that?
You could.
Because like you walk in.
You could. You could have normal gloves. I knew if I put gloves on, I wouldn't be able to get that dressing off.
I got you.
And the important part is that we're avoiding the area of insertion, okay? And we always wear masks. So I put my gloves on. This table. Okay. So once, oh, don't tell me they got, oh, alcohol. Okay, good, good. Normally it'll be betadine. So you want to ask your patient again if there's any allergies, right? I'm going to go ahead and open up my jeez. Some of the kits have an actual like a little tray, so you can lean this on the tray. Oh, this is chlorhexidine. Okay. So you may have multiple solutions to cleanse. My rule of thumb is I start with alcohol around the area to get the old dressing stickiness out. And then I proceed with the chlorhexidine to cleanse the area again near the insertion and the catheter itself. Okay, so I opened up that. And if you notice, you have a label. You have a gauze that you can utilize by holding the catheter up. And you have a Tegaderm. And your BioPatch, which has a bifurcation. Blue side up, the white goes against the skin. Okay? So, I'm going to begin with the alcohol. I'll hold the catheter up. Make sure you're not pulling it. And I proceed on the outer areas. Make sure I cleanse. And I have more of the wipes. So I'm going to go ahead and use all my wipes. As many wipes that I have, I utilize it. Now I don't want to use the alcohol on the catheter itself. I'll leave that for the chlorhexidine, okay? I ask my patient, how are you doing? Are you doing okay? And I'd like to also look at the site, make sure there's no problems. Is there any drainage, any irritation, any swelling? Okay, so that's done. Then I get my chlorhexidine. Can't get this off here. I should have cut it. Okay. Here we go. Okay. And I start at the edge, make sure I clean very well, and do the catheter, especially the catheter that's going to be covered with my Tegaderm, okay? I still have one sterile hand, this one no longer, because I had to touch to move my gauze. Okay. So, I'm going to let go of this. And I'm going to get my BioPatch. Since I had to use this to move my catheter, I'm not going to use this hand. And then I go ahead and this part, like that. It's going to go, oh, shoot. Oh, stay. And of course, you want to let it dry before you put your dressing. Okay? Now, once your gauze is there, oh, darn it. Having trouble with this one. Here we go.
I assume the patient would be at like 30 degrees or something.
Oh,
that
yes.
They wouldn't be straight up.
Yes, no, not straight up. Okay.
And why do we use that circle thing?
This is a different one. Some of them are just Tegaderms.
No, the circle.
Oh, because
Biopatch?
it offers protection for infection.
Oh, okay.
Additional areas to prevent infection. They
Is
call it a
like
biopatch. It has
antibiotic
like
or anything on the surface, or
it has like antibacterial
Okay.
on that side that is against the skin.
Okay.
And then just like any Tegaderm, you want to pull the paper dressing off.
I can never do the Tegaderm,
I know.
like for IVs and stuff.
There
I
we
always
go.
do it. I need like labor. It's like no shirt.
And my kit did not come. Oh, here, it does have a tape. Good. So I'm going to not leave this dangling. I'm going to go ahead and put a tape on it to hold it up. Okay. And then you would put your name, your date, initials instead of your name, and the dressing change. It says needle size and type, but you can put central line, dressing, CLD, and you put that on the site when you changed it. And there you go. So then you can remove the mask on your patient. You can remove your mask. Oh, God, I hate masks. Especially if we wear glasses, it starts to fog up. Now it's up to you. You can get an extra gauze if you want to. Or if your kits came with one, then that's perfect. To utilize that to hold it while you're cleaning. Okay? Questions?
For
So
the,
once, yeah.
there's I forgot what it's called, but it's basically a needle that you like put in.
Okay, those are, yes. That would be, let me move my tape here. a
Would
little
that be kind of like the same type of dressing change?
bit. Yes, it would be a